just the world. There are children who are not autistic that have sensory processing delays and sensitivities to foods tactile. So the way foods feel in their hands, in their mouths. Also sensitivities to smell. So like they may have a very adverse sensitivity to the smell of oatmeal or anything. A lot of the children that I have done feeding therapy with who are autistic, most of the ones that I have seen as a feeding therapist, it doesn't mean all autistic children have these sensitivities, but most of the autistic children that I have done feeding therapy with have very intense sensitivities to smells of food, to the look of food, to the touch, the way the food feels in their mouth, in their hand. And they have had only a few things that they would eat. Even I've had kids who are autistic that are 5 years old and they will not eat food. They are still drinking Pediasure from a bottle because their parents have tried and tried and tried, even with feeding therapy with other specialists. And it's not easy. I have a son and he does not have sensory issues with food. And as a mom packing his lunch for preschool, I still worry about, am I putting the right things in for him to eat, that he will eat? And sometimes he doesn't eat everything. Sometimes, it just depends. Now imagine being a parent of an autistic child with sensitivities to eating, or a child who may not even be autistic but has sensory processing delays and sensitivities with or sensory stuff with food. And you have to think about what to pack for your child in their lunch that they will actually eat when they go to school. And it's very hard. And on top of maybe they only eat certain foods because they can only tolerate certain foods because the other ones are, they're sensory, they're too defensive sensory, whether it's smell, tactile, look. Imagine trying to pack a lunch for your child if those are issues. Then on top of that, 6% of autistic children